I refrain when he pamu, and so damn and Payane said, Miram Papa, why I'm here. Essiane Kajania said, I refrain when he pamu, I dear Bakona Miss Rene said, Miram Papa, why I'm here. I said, me pump, Koshamechi, baby, I'm a friend, baby, I'm a tree, or therefore, why now better me on your way. I said, you should stand by and take account. Or therefore, wait there, it had to be you. That's right. I said, me boom, koshamechi. Baby, I'm a friend, baby, I'm a dream. Or therefore, why now better me on your way? I said, me stand by and take account. Or therefore, wait there, it had to be you. Empty more. I refrain when he pamu, and so damn and Payane said, Miram Papa, why I'm here. Essiane Kajania said, I refrain when he pamu, I dear Bakona Miss Rene said, Miram Papa, why I'm here. I said, me pump, Koshamechi, baby, I'm a friend, baby, I'm a dream. Or therefore, why now better me on your way? I said, you should stand by and take account. Or therefore, wait there, it had to be you. That's right. I said, me boom, koshamechi. Baby, I'm a friend, baby, I'm a dream. Or therefore, why now better me on your way? I said, me stand by and take account. Or therefore, wait there, it had to be you. Empty money. So closer than the brother, so closer than the brother. Truth is, I gave up on myself, cause my back was against the wall, and it was one in us, but I gave you a call, and you answered my prayer at once. You made a way.
Folks, it's the end of the year. This is December 7th. We are grateful for God has been good to us all. If you're here with me, if you're alive, and if you're watching me today, God has been great to us. We must give thanks.
I said, stand back and take account. Or therefore, wait there, it had to be you. Empty money, money, I let you waste a look, money, 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 I don't need to share more money.
As usual, I'm here on Facebook Live. If you can, please join me. Make sure you share so others can join us live. Watch and listen with us. It's time for us to be aware. Simple First was HIV Awareness Day. HIV Awareness Day. Therefore, we will use this opportunity to discuss HIV, to remind ourselves that HIV is real, it's still there, it's still a pandemic, it hasn't gone anywhere.
And again, money, money, and again, money,
Viewers, viewers, as I said, December 1st was HIV Awareness Month. Therefore, I will use today to discuss or raise an awareness of HIV. Corona has come, other diseases and pandemics has come, but HIV is still there. We must be aware. It hasn't gone anywhere yet. Therefore, we must be aware and protect ourselves. Therefore, we must be aware and know how to treat each other and our sisters and brothers with HIV. Okay, like I said, if you haven't joined me, if you are here, please share. Have others join Our heart and thoughts, our minds are with everyone in Ghana, Ghanaians. Our thoughts and our hearts and our minds are with you guys. Our prayers are with you guys. We ask that tomorrow, please go out in your numbers and vote. That is your right. Go out and make your voice heard. Vote, cast your vote peacefully, and go home. If you have to hang around, you should not engage in any arguments. Please vote and go home peacefully.
That's right. I said me boom pom pom koshamechi. Baby I'm a friend, baby I'm a D. Or therefore, one over to me away.
God has been good. God has been good. I mean, it's December. It's the end of the year. A lot has happened in 2020. And we're still here. We have to be grateful to God. We have to be ever grateful to God.
Money, money, money,
Viewers, I'm here on Facebook Live. If you haven't joined me, or if you just joined me, please share the page, like it, and share so others can join us on live. If you're here as well, please type, say hello, so I can recognize you. Say hello so I can recognize you. Like I said earlier, December 1st was HIV/AIDS Awareness Day. December 1st was HIV Awareness Day. Therefore, I'm using today to create an awareness of HIV. This is the day for us to remind ourselves that HIV is still here. It hasn't gone anywhere. It's still there. Other pandemics has come and go. HIV was the same, but it's still in the system. Therefore, we need to protect ourselves. We need to protect ourselves.
Or therefore, it has to be you. Money, money, I don't know where salute, money, 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 I don't need to share more money, 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 I don't know where salute, money, money, money,
So when you ask yourself, what is HIV? I mean, we know HIV was a deadly disease that everyone was scared of when some of us were growing up. I mean, nobody wants to be an HIV patient. All we know is that HIV, people get sick, they lose weight, and most of them die. And so you ask yourself, what is HIV? What actually causes HIV? And what happens when one gets this infection? What happens when one actually gets this infection? So today I will explain a little bit of mechanism as to what happens when one gets or infected by HIV virus, and some of the signs and symptoms, and what we can do to protect ourselves. Also, to be aware that anybody can get HIV, even if you try to protect yourself, because accidents and mistakes are doing. So that is also the other part that I want to discuss with you today. What is HIV? As I said, HIV, acquired immunodeficiency syndrome, is a chronic, potential life-threatening condition caused by this HIV virus. Okay, it's a chronic, potentially life-threatening virus that is caused by this HIV virus. And what makes it so severe is that when one is infected by this virus, it tends to attack your immune system. It tends to attack your immune system. What does our WBC do? Our white blood cells do for us. Our white blood cells is one of our blood groups that actually protects our immune system. It actually protects our immune system. And this particular virus, which is HIV, when one is infected by HIV, it affects this blood group, which is your WBC. It affects your white blood cells, and this is when all these signs and symptoms of losing weight and all of that comes in, and we are about to get into it. Let me actually check on viewers who has joined me on Facebook, and that I will come back. And like I said, if you join me, say hi. I've heard folks asking me, what do I do for you to know that I'm here? Because I do hear you mentioning names and I don't hear my names. If you don't say hi or don't say anything, then I don't see that you're here. Therefore, I ask that if you're here, make sure you like the page, share it, and say hello, and I'll be able to recognize you as well. So our studies, like I said, is on HIV and what happens when someone is infected by HIV virus. And like I said, when someone is infected by this virus, it tends to attack your WBC. And your WBC, which is our white blood cells, is what actually protects our immune system. Therefore, when you're infected by HIV, it works hard to weaken your immune system because it works on your WBC, and that is what makes it life-threatening disease. Life-threatening disease. So then you ask yourself, what are some of the, let's say you haven't actually done any blood tests or anything. You're going about your business, doing all that you're supposed to do, and you don't even care. Because I have come across some patients when usually when we ask them, can we do HIV tests? They do deny and say, no, I've been in a relationship for how many years and I haven't cheated, maybe my husband hasn't, it's a good man, and so no, I don't have HIV and I refuse to be tested. And you ask yourself, so this is why I'm here today. This is why I'm here today. Yes, you might have been in a relationship for how many years, and you're faithful to your partner, and that you don't expect to have this virus. As we know, the mode of transmission of this virus actually, it's as we know, it's a way by blood and blood products, by it's a sexually transmitted disease, or you could get it through blood, maybe blood transfusion, or sharing needles. And that is when people do drugs, they tend to share needles, and when they do that, you can also attract HIV from that mode. One other way is that most healthcare workers will tell you that whenever we get a splash, or we had, even when you get a needle stick or anything, you have to get tested. We usually have things that we do on the spot, and right after that you have to go get tested, because emergencies are there, and some people, it might be a very minimum, but yes, some people had been infected by HIV this way as well, and this is not a way that many of us will expect to be infected, but it does happen and so we all have to be aware. I encourage you to do your HIV test. I mean, it doesn't mean that you have HIV, but it's always good to know, because for you to know is a way for you to take care of yourself. If you don't know, then you wouldn't care for it. And so it's good to always be aware, whether you have it or not, to be tested. When you go to your doctor's office, ask that you be tested for HIV. Usually you'll be asked to be tested for HIV. Many try to refuse it, but if possible, test yourself. Just be confident, know what's going on. That doesn't mean that you have HIV or not, but you'll be surprised at what you will find, or what you're gonna find as well. So get tested. Today you asked, the question is, how would I know if I have HIV or not? Some of the symptoms of HIV is what I'm going to discuss. So, in the beginning, when someone's WB2 is affected by HIV, they go through this primary phase of the disease. Primary phase of the disease, when they will have a minimal, very minimal symptoms of flu-like, flu-like symptoms, where they will have mild headaches and body aches and maybe some chills here and there. Not so severe to even consider it as anything. Not so severe to consider it as anything. But if you do get these signs and symptoms, mild chills, night sweats, you having runny nose, body aches, and it's not as severe as you it comes today, you're good, tomorrow it comes back, you should try to find out what's going on with you. It might be just flu, common flu. It could be that you're tired, but it can also be the primary phase of HIV, and so you need to be tested to know what's going on with you. From this common phase of HIV, it progresses into the latent part of the disease, where you will have no symptoms at all. Where you will have no symptoms, and when you don't have the symptoms, the virus will then be working underneath to weaken your immune system even more. And so in the beginning, which is the primary phase of HIV infection, you will find out that you'll be getting flu-like symptoms. You have muscle aches, a little bit of chills, night sweats every now and then, some headaches, which is not, like I said, it might not be as severe that will prompt you to seek medical attention, but then it might be the primary phase of HIV infection. And right now, I just want to say that, as our fellow Ghanaians, those people who are watching me, like I said, tomorrow is election day. As I'm talking, I'm also have you all in mind. Please go ahead, go out in your numbers and go vote for whoever you want to vote for. Go out, cast your vote, go back in and even if you have to hang around, try not to engage in any conversation or arguments that will cause any violence. It's
stand by and take account. Or therefore, wait there, it had to be you. That's right. I said me boom pom pom kosha mechi. Maybe I'm a friend, baby I'm a D. Or therefore, why now wait to me on your way.
Folks, as I always say, water is life. If you don't have your glass of water or bottle of water, please use this time to grab your bottle of water and take sips. Water is life. It doesn't matter what. It's always about drinking enough of water, making sure that you're well hydrated. And so don't forget to drink water. If you haven't had enough water, much water today, this is the time to do that. Grab your seat, have a seat. Let's continue our talk. So we just talked about primary phase of HIV virus, where you have flu-like symptoms, very mild. You might not even be aware that you have anything severe, or it wouldn't even prompt you to go and sought medical attention. But it could be the first phase of HIV virus. Therefore, I ask that if you see anything like that, it could definitely be common flu, but if it's not, make sure that you go, you know, to your doctor. So especially when it comes, it goes off the next day, and then, you know, 2-3 days after you show the same symptom, you have to know that something is wrong with your system. Like I said, from the primary phase, you go to the latent phase of the virus, of the disease, the latent phase of the disease, where you will have no symptoms at all. You do get no symptoms at all, but you realize that you know, you're okay, you're going about your business, everything is fine. But that is one serious part of it, because then there's nothing prompting you to go sought medical attention or anything before you know it. Before anything. From the latent phase of this virus, you go to the symptomatic phase of the virus. You do go to the symptomatic phase of the virus. Right now, as I said, if you have joined me on Facebook, please say hi, give me a shout out or something so I can recognize you. Money, oh, hey, money, oh, money, oh. I got to my salute, yeah, money, oh, money, oh, money, oh. So I see my brother here who said, hi, Obaapanin. Hello, thank you for joining me. Thank you for joining me. And again, money up, money up, money up. And I'm touching my money up. And again, money up, money up, money up. And I'm touching my money up. And again, money up, money up, money up. And I'm touching my money up. Okay, so from the latent part of the disease, you do progress to symptomatic part of the disease, and that is where you do develop chronic symptoms, where you do get this constant diarrhea. You have all these rashes that never goes away. Even though the primary phase of HIV, people do get rash. Usually, rash is one thing that usually helps to be diagnosed, because that is a type of rash that never goes away. It will be treated with whatever needs to be treated with, whatever antibiotics that usually used to treat that type of disease, and it will never go away. And that usually prompts the doctors to test this patient for HIV, usually in the primary, but at the symptomatic phase of HIV disease, which is the last phase of HIV, usually people do get all this, the constant diarrhea, these chronic symptoms. Constant diarrhea, they do get all this cough that never goes away. They do get weight loss, massive weight loss. I mean, they have no appetite to eat at all, and so they go through this massive weight loss. And remember, if you're not able to eat, you're not able to build the immune system, and this disease or virus actually attacks your WBC, which is your white blood cells, and your white blood cells is what actually protects your immune, your immune, and so it affects and attacks your immune system. And because of that, when it gets to the symptomatic phase of the disease, you're not able to eat. You have this constant diarrhea going on. You have no appetite at all. Night sweats, massive ones. You can't sleep. You're coughing, and all these symptoms is going on. And this is when people lose weight. They lose massive weight, like I said, because they're not eating. They can't eat. They have no appetite to eat at all. They're having this diarrhea. Meanwhile, somebody who is not eating and is having this constant diarrhea, what do you think is going to happen? Of course, they're going to lose weight. They are going to lose weight. They're going to lose all of their electrolytes. And this is when you see HIV patient, mostly those days, you see this HIV patient who look very frail because they lost all this weight because of this diarrhea and no appetite and the night sweat. They can't sleep and all of that. But thank God for now, we have medications that usually manages these symptoms, which makes them live very long. The fact though is that to this date, there's no cure for HIV. there is no cure for HIV, but there's medications that are used to actually manage these diseases very well than before. Before, even when some of us became nurses, we used to have this cocktail that we used to give our HIV patient, and the side effects for these medications alone were massive. That alone throws the patients off from eating and doing anything. But now we have one medication that has 3 medications in one, combo pills, and patients just take one medication and they are good. They're good. They go about their business. They eat well. That you and I will never suspect that this person has HIV. And this is why I'm here today. Many of our friends that we mingle with, many of our friends that we eat with, many of our friends that we work with, most of them might have HIV. Therefore, we have to be mindful of who we mingle with, how we walk around, how we play around, and all of that. There are people who are very careful as to what they do. Once they have that disease, why would you be going out and telling everybody that I have HIV? It's something that you don't hear on the streets. You don't usually hear people or friends telling you that I have this virus. Somebody I know will tell you that my blood is tainted, and that she's trying to tell me that she has HIV disease. She tells me, oh, my blood is tainted. I'm like, what do you mean by your blood is tainted? They're like, I have the virus. And come to find out, she was diagnosed with HIV. And that's one of the nicest people who will come out and tell you that I have this. Either that you wouldn't know. But like I said, because of all these new medications out there, people with HIV are just like anybody who hasn't, anybody else. They are not losing the weight because of this meds. They might not be having all this constant diarrhea that makes them lose weight, and so they look normal like everyone else, and so you wouldn't know. So be mindful. I'm here to, encourage and remind ourselves that we have to be mindful of our surroundings and as to what we do, who we mingle with, and certain things. There's something called universal precautions, where we always tell everyone that just treat everyone who comes to your way as if they are infected with something, even though they're not. And that is a way or something to do to protect yourself. So this is why I'm here also today. Treat everyone who comes your way. Whether it's your best friend, your colleague, whoever, as if they have infection. This is a way to protect each other. Because like I said, many will not come to you and tell you that maybe my blood is tainted. Like a friend of mine told me my blood is tainted. But they will, like to eat with you. They will like to drink with you, sit with you, and do everything with you. And so it's up to you to be mindful and protect yourself as usual. That way you protect each other. Another thing also is that the fact that somebody had HIV doesn't mean that you shouldn't come close to those people. There is mode of transmission that we discussed, and that is through blood and blood, body fluids, and maybe through needle sharing and all of those things. And so once you're mindful of these, you can hang around and interact with people who have HIV, because they're normal people like you and I. HIV right now is just a condition. Just like somebody had blood pressure or somebody had diabetes. And so when you find out that somebody is diagnosed with HIV, do not treat them differently, because they're just like anyone who is not, or who doesn't have that HIV disease. Treat everyone the same if you can. You just have to be mindful and protect yourself and do the right thing, and everyone will be good. And everyone will be good. This type says, good job, Obaapanin. Thank you.
So damn it, I said, me remfi papa why me. It's ya neka janya sido. I refrain when nipa home. I dear back na misrane said, me remfi papa why me. That's any pump kosha mechi. Baby I'm friend, baby I'm ready. Or therefore, why now bet to me on your way. I said you so Or therefore, wait there, it had to be you. That's right. I said me boom kom 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 shamechi. Baby I'm a friend, baby I'm a baby. Or therefore, one hour to me on your way. I said me so sissy. Stand by and take account. Or therefore, wait there, it had to be you. Empty money.
Okay, viewers, as I say, if you just join me or you're not watching me, our topic today is on HIV/AIDS. December 1st was HIV Awareness Day. HIV Awareness Day. Therefore, I'm encouraging and reminding you that HIV is still a condition that is out there, and that we have to protect each other and protect ourselves against it. It's something not to play around with it. Why do I say that? Because HIV is an infection that actually fights to weaken your immune system, and so it's very serious. There's no cure for HIV as to this date. It has been there for a while now, and many diseases comes and goes, and there are vaccines and stuff that we usually use as prophylaxis to protect ourselves, and HIV is not one. Even though there are medications to manage the disease, there's no cure for HIV. Therefore, we still have to be mindful of HIV. And as I said, because of all these drugs and medications that are out there, people are able to live long. People are able to live and walk around and manage their lives better than before when HIV first started. You might not even see people with HIV losing weight and having all these diarrheas as that will help you to suspect that a person is diagnosed with HIV. And because of that, you have to be mindful, and as I said, treat everyone around you as if they have some sort of condition. This is a way for you to protect yourself and also to protect them. As I said, there's something called universal precaution that usually healthcare workers use. And when I say universal precaution, what do I mean? That is to treat each one as if they have some sort of condition, even though they don't. But that is a way for you to make sure that you protect yourself and also protect others. And so let's be mindful, as you know, people that we mingle with, our co-workers, our friends, people that we go to church with, you'll be surprised to know that they're diagnosed with HIV, but because all these drugs are out there that helps them to manage. These days it's not about this cocktail where we have a cup of drugs, a cup full of drugs for a person to take at one time. It's only one pill with 3 medications made at one, a combo pill, and it really does help them. It really does help them. In the US, people barely tend to have the AIDS. When they have HIV because of these drugs, they're able to manage and don't get to AIDS, the final part of the disease, because of these drugs. And so it's hard for you to know, and so you have to protect yourself. Be mindful, and be mindful.
Esiane kaja yasida, I refrain when nipa hu, and so damn me paya me say.
Thanks for the enlightenment. I'm learning a lot. Thank you for joining, sis. Yes, we all learning. It's time we learn from each other a little bit.
Or therefore, why now better me on your way? I said you so sissy. Stand by and take account. Or therefore, wait there, it had to be you. That's right. I said me boom kom 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 shamechi. Baby I'm a friend, baby I'm a baby. Or therefore, why now better me on your way? I said me so sissy. Stand by and take account. Or therefore.
And as I said, tomorrow is election day for our fellow Ghanaians. Our prayers are with you all. We're praying that tomorrow's election goes well. Tomorrow's election goes well, and that go out in your numbers and vote. Cast your vote. Vote for whoever you want to vote for. Whoever you think will help to lead well and have everybody have peace of mind. And so go out there and vote. but make sure you don't engage yourself in any argument. Do not engage in any argument. Vote and go home peacefully.
So you hold me close, so closer than the brother, so closer than.
Yo, Sabre, me mama, any papa mo, I am me. I also do get the complaints of me not speaking the dialogue. So, and then Sabre, your topic no HIV/AIDS. Kakra, what can I say? And so December 1st, HME na HIV Awareness Day. December 1st, HIV Awareness Day. And unti ye yusu and net day united the akaka who say AIDS no, which is HIV no AIDS no, and call baby a guso ewo system nim. A guso ewo system nim and unti young person na young boy young hopine and free HIV AIDS.
Take account or therefore wait it had to be you. And take money and a true salute money I don't need to check money
AIDS a den na esi se ka se obi enya HIV AIDS a den na ekoso ewo ne mogem anase ni nipadua ni ani ekoso se ka se obi enya HIV AIDS and say there is sa aboa bi a ono de oba ne oye ne se ade na ewo yi mu anase moja ewo yi mu ebo ya pomuden ho ban ankasa no eno na ono de oba o target oba eno na o target enti no se sa ya be wunya eboa anase eye adwuma against sa moja ewo yi mu eboa wo ya pomuden ho na ebre na se sa ma wunya ohun dododo kakra na obeka se bia wanya ebi kra wo gara na se ya obeka se wanya fever anase bia wanya malaria na obehu uti o ya kakra na obehu se ase awo edo kakra eba kakra na eko na eno na ba ne sa na emfa na tra keke e wo se obomode make sure say wako wo doctor ho na wako test by test who say den ekoso na se okoye mpo na friends fever cramp se obehu afen so ye bebre na ye hospital na ye doctors try say omo be check ye status se bia wo ace na se ya bebre na ye ka say me de me den na menya ace if you say I've been very faithful na de me eka and say mesre say se obehu say impo wonni bi enu nti se wo ko na ye o doctor bisa say opese wo ye wo HIV test na penemane nya na the only way I will be me ahwe wo ho so yi ene se obehu say mi ni bi anase mi wo bi a wo ho tane obehwe wo ho so yi afa na wo ni bi nso a eno nso wo ho sane a obehwe wo ho yi afa enu nti emane nya ohuhu bi name se obema ya test na wo hu wo stand baby a wugina se wo bi ana ase ni bi na say na me kan no say usually no obi nya sa yare ya no say yare nya obi a first face no in the beginning no na say mfiti ase no de wo ene say ya na wo dodo kakra na say wo ye omre wo na mamu ye omre na wo ho asa na joda na mfifiri tetel kakra bi ebi also a rush with genital areas no rush bi na bonse na egugu honom rush bi anka ye make ye de penicillin bi fa so na anka enko wonko a wo de ne de ye de fa so pra enko nupo na ye more science na sometimes the doctors no timi suspect say bibi say ewo ho nti say omo person omo test wa ma omo kwan na omo ntumi test say ufri ho a ufri sa first stage na of HIV infection symptoms na e dey call another stage bi a hono dey omo say latent mau symptoms bi nti wona na ho okay ukoba wo ye wadwuma I mean you going about your business but ni nyina no na yare no ye adwuma underneath ye adwuma wase a obia enhyeda enhu se bibia wa wo de wo kra wo hu se bibi koso na ye adwuma ni nyina no na che se say umu niema mo enu nti ebe ye umu adwuma be hyehye wo ho unnim ne koso wo ye okay just like everybody else na ewo hwa afi who say what science start who say afi de wo didi a aduane eto wonu ma na eba diarrhea eto wonu ma na eba afi kra ha de bedu ba bi no woni appetite bia wo mfele se ubedidi wo mfele se ubedidi wo hwa na chills aso ho wo so kakra na ohu wo so wo da na dwa na empanyina afọ da na dwa na empanyina afọ eno enso so eye third sign eno so che say sabre time na unya symptoms bia no na to say aboa na o hye wo no ana say the virus no or damage immune system me pa na say na me kan no virus we virus bia ono de oba wo mu a ne awoye ne say emoja ebo yempomuden ho ban no na obe attack no nti no obe attack no pa make sure say damage wo ma untumi enye wo ho ahwe na no na say wanya edru papa bi to so mo wo amonene outside Ghana and I say outside other countries and I say woni hu sika wo betumi e de atoto sa eno e bi ahwe wo ho a sa a free sausage na a lead into the full blown AIDS na no de go do ha na say asay wo mu niam nyina ebe kwa kodu ho na say asay wo mu niam nyina na ne ya kan say till this date no HIV AIDS e ba ya che ye pa na so yare bebre na aba akwa etimi nya ebia vaccine a ye de protect ye ho se na we a wunya yare no anase ye nya anu aduro etimi esa yare no na sa HIV AIDS de till these days no ye nya ehno aduro bia eni ti ye ni adura ye de kuno na emom ye wa adura se wunya yare na etimi ede so anu eni ti the earlier the better se wo check in ntem na hu se wanya eno na wutimi no se eno ede so anu na wanya ne sa na wo twa ma ne ya last minute na to say wo full blown AIDS na to say condition no a worsen edu time aye no hwe a enye ye eno nti ni nua no e ma me no me papa no na fofo ene ma dofo a ene mutie me ne me kan say a pene ma wo doctor en check you na ye hu HIV no se wo bi anase wo bi anase wo hu a eno na eye eno na betumi aboa ama wabo ho eban na betumi aboa ama wabo ho yo na se me kai mo de me san aka so medical kan na de me kan so ne se yenyamo Ghana for nyame adom ochina election day nya yesre ene se obia enko abonten na onkoto aba no onto ne boko sene ye ya no da no mre ne mwe na ye kwa ye tu boko na ye kofie Ghana anase Africa enko bebre ni a wo ye nyina ne se wo hyen omo hye Ghana and then I walk into so we so free Ghana and that's how can say Ghana for the mutia nti mo ma ye mo aye ho let's help ourselves na sa kasa no enka ho na enye enko entokasem bia yenkoto aba no sanya wose ye to no yenko fie na yentwen results ne so ba sanya eti bia mo ma yenyin tum sa pepepe ni nyina na yenye den yenko ye yo munya ba Obaapanin Afua Konama enne ni amewo amede ebremo enni HIV AIDS eno ena amede abremo moma yen protect ye ho sani amekan no moma yen treat obi biara owo around us as if say owo yare ni bi eno ene ekwan a ebeboa ama wo de bebo ho ban na wo de bebo obi unia ensoso ho ban eno nti na ma no esi na me adoma akwese da ebe so ayebesan abana ne wo ho no yede abremo enanti na ne ameka ne say me di nyame eja obi bia
Esiane kajanya sita arefre woni pahu enso da me paya ne se mi remfi papa wa ya me esiane kajanya sito arefre woni pahu ade aba ko na mesra ne se mi remfi papa wa ya me wa ase mi pon ko shamechi e bia mi frene be bia medi o therefore why now better me away ase mi susu sisi stand by and take account or therefore wait it had to be you That's fine. I said me boom pom 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 shamechi. Baby I'm a friend, baby I'm a bee. But therefore, one hour to me on way. I said me so sissy. Stand by and take account. But therefore, wait yeah, it had to be you. And take money oh. I don't true I salute yeah, money oh. Money oh. Money oh. I don't need to touch more money oh. Hey, money oh. Money oh. I don't true I salute yeah. Money oh, money oh, I don't need to touch more money oh. Nipa, yeah, me touching you, hold me close, so closer than a brother, so closer than a brother. Truth is, I gave up on myself, cause my back was against the wall, and it was one in us, yeah. But I gave you a call, and you answered my prayer at once. You made a way, but I gave you a call, and you answered my prayer at once. You made a way. 1, 2, 3, and 4. Me boom 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 shamechi. Baby I'm a friend, baby I'm a bee. Or therefore, one hour to me on way. Hey, I said me so sissy. Stand back and take account. Or therefore, wait yeah, it had to be you. And take money oh, money oh. I don't true I salute yeah.